everyone. Welcome back to the podcast. Welcome all new listeners, and welcome back to those who have heard my content in the past. Today's episode is amazing. If you are a new grad, you are a student, or you're a seasoned clinician and you're trying to figure out, is cash physical therapy for me? I love working with athletes. Is cash physical therapy for me? Should I start my own business? Should I work in a cash pay clinical setting? What are the ups and the downs? Today, we're going to explore that. And I have an amazing guest who has a long lineage within my ecosystem and my world, and is still crazy enough to have a conversation with me online and is still interested. This is crazy. Usually, I repel people away with my personality and my philosophy. So I'm excited to have Elise Garcia. We are not related by any means. We just have the same last name. Elise is a third year physical therapy student in Pomona, California. And so Elise volunteered. Those of you who know how I work, I'll just ask you to come on the podcast, and you usually say yes. So Elise was asked to come on, and she asked me some questions about business development, and I wanted to share with the rest of the world. I think that there's some really good context to where Elise's thoughts are, and finding herself in a new career path. So I wanted to bring those out to you guys because you probably have the same questions, whether you're a student or you're a clinician. So Elise, thank you so much for joining me. Tell me about you. Let's tell the rest of the world who you are, where you are in your career path, what you're considering, and then how you found me and this podcast and everything about that. Go for it.
Okay, I'm happy to be here. My name is Elise Garcia. I am currently a DPT student at Azusa Pacific University. Um, I've been volunteering with Dr. Chris for not currently, but back in since COVID. So I saw him go through that little hump a little bit. I didn't see like the business aspect and behind the scenes of that part, but I was also patient with him, and he kind of was the pillar and kind of drove me and inspired me to pursue and kind of locked in that decision of pursuing that career in physical therapy. So right now I am a third year, and I'm starting to think about, I graduate in December, and now I'm like, oh, what's going to happen next? I'm trying to decide, am I going to go outpatient ortho? Am I going to work with sports? One thing I do know for sure is I want to love what I do, and I want to avoid that burnout. And I've had some conversations with Dr. Chris about this. So I'm hearing a lot of good things about being in the cash-based setting.
Yeah.
And so Dr. Chris, can you tell me a little bit more about how the cash-based setting can kind of deter from being burnt out?
Yeah. So this is a good conversation we had. So first of all, thank you, Lisa. Let me just wrap this up for Elise, because yes, she was a client of ours first for her ACL, knee ACL, yeah.
Yes.
And then full blown into intern. And in being an intern at Sports Performance in my company, it's a little different than just pure observation, everything else. There's a lot that we get help with, and a lot of times we pull our interns into being team members, and there's a whole way of going in that route. And Elise was a superstar, so she went into internship and is now full throttle, and she's interested now, and she's seen it firsthand. Now she's trying to figure out what the next step is. So yeah, so the concept of burnout, right? So um, you're going to hear this in PT school, and I think new grads probably 0 to 3 years out, you feel this, right? So it's it's unfortunate, but it's an emotional attachment to a feeling, right? So like some people could say like, well, you played collegiate sports at least, right? Right.
Yes.
So would you say that that was a lot of work or a little bit of work?
A lot of
A
work.
lot of work, right? So it was balancing your academic career with playing sports. And now there's people who take a full caseload and they're busy and they think that's a lot. And then you did the same, but you added soccer, right? The mental stress, the physical stress on top of a caseload. So the concept here is, why didn't you get burnt out there?
I was super passionate about soccer and what my work and my education. I was really happy in both settings, so it didn't really seem like it was work. So that was like the key factor there.
100%. So the concept of burnout is when you're not emotionally attached to it, or it's detracting from your ability to stay emotionally attached. So for instance, say you were taking 18 units and you were playing full-time soccer. Most people can't handle that. That's burnout. But your passion for both was incredible, right? So the
Right.
concept of burnout in PT school, like they warn you. I just gave a talk at St. Augustine in San Marcos, and we talked about this, right? So the concept of burnout is an internal feeling that you no longer have an emotional connection with. And so the crappy part about this is that when you go into clinical practice, you're in love with it, right? You're infatuated with it. But for some reason, the amount of documentation, the amount of work, the weekends, the lunch hours, the nights, everything else that you have to do becomes very difficult. And for some reason, you're like, I'm burnt out. Well, it's because you fall out of love with what you're doing, right? So you're still helping patients and clients, but the problem is there's an emotion, there's a administrative burden that doesn't allow you, it helps you fall out of love with it. And so it's an emotional attachment to something. And so for a lot of people, people don't realize that like burnout is just your how close and how passionate you still feel about the thing that you love. So I think personally, I think that um you weren't mentally prepped for the amount of crap you're going to have to deal with, unfortunately, to get to patients and get to work with them. There's a hump you have to get just administratively, and then to keep them, there's another hump. And now you're questioning, well, shit, I don't know if it's worth it to get 15 minutes with them to do this much work. And that's where burnout happens. So I think for a lot of you, if you're considering working in any setting and you're thinking that burnout is there, um, burnout is only because you didn't know that that was going to happen. And I think if you know that going in, it's that expectation, you're about to get swamped with paperwork, or find another way to deliver outcomes without getting burnt out. And for a lot of people, that's a cash pay setting, or you create a cash pay niche in the company you work for already.
Mm.
And that's different. It doesn't mean you have to leave. Like maybe you have the dream scenario. You like live 10 minutes from your house or 10 minutes from work, and you love this place, except they just have a lot of insurance, Medicare, Medicaid, whatever it is. You want to help those people. Why then, instead of leaving that facility, why don't you create a cash pay niche? So then maybe 3 of your days are seeing cash pay patients.
So at that point, I could carry over some of the patients I'm already seeing and being like, oh, this is also my business. I can continue to help you and reach those
Yeah.
outcomes.
Yeah, so a lot of times as a business owner, what'll happen is you have an opportunity to maybe work with the owner of that clinic and say, hey, listen, I'll give you an X amount raise, or I'll give you X amount of money for every patient that you bring in, or across the year, let's see what you bring in, and then let's calculate what bonus that you'll get. So it gives you an opportunity to maybe have some salary, to have some stability in your life, and then maybe ask the owner and be like, listen, can I create something, carve something, and have a bigger chunk for me to be able to help your business? And that way you don't take the risk, you still have some stability. There's a lot of layers here that people can do. So I don't think it's an and like, sorry, I don't think it's an or, like cash or insurance. I think there's a blend that you can do here. Now I think there's, now that you're making me bring these things up here, I think that there's people who want to go own their own business. And I think if you're crazy enough to do that, and you want to have the stress and everything else, you like that concept, you're probably addicted to that. So you're cool, good for you. Then there's people who are like, I want stability. I want my paycheck. I want to be able to play with my kids. I want to have a house. I want to have a car. And I just don't want to stress over those things, but I want to work with cash pay patients. Okay, two different people. And then there's people in the middle who could be potentially, maybe they spend a little time, they work in one industry, but then they've created a little niche for themselves that they're making extra money working with cash pay patients and still working in a very good setting in an insurance-based world. So it really depends on who you are and where you fit in that profile. And I have no idea where all the listeners are, but it gives you a little bit of options. And I think that's maybe what you're trying to figure out as a student. Maybe that's one thing. Is
Yeah,
that
for sure.
where do
I
you
was
jive in there? Where do you fit in there, Lise?
Oh yeah, I was just telling you that I was in between kind of owning my own clinic, cash-based clinic, but also like, oh, should I just suck it up and deal with like their insurance? But I didn't realize that you could have a little bit of both. So that's awesome. I think I
Yeah.
might go that route. We'll see.
Yeah.
But I think that's awesome to have that option.
Yeah. Yeah. So I think for a lot of you, don't be concerned about burnout, create opportunities, because there's a lot of business owners who are looking for that. The problem is that they don't have anyone, shouting out saying, "Hey, I'd be willing to help. I'd be willing to support." And I also don't think that as an employee, maybe you don't consider those things. So, yeah, just more things for you. So you asked me some other questions within your survey last week. What are some of the extra questions that you wanted to ask? And then maybe, well, let's talk about some of your takeaways and, what would you do as a new grad? What would you do to set yourself up for opportunities for the settings that you're interested in? Go for it.
Well, I had a couple questions based on the cash-based setting and just owning the clinic, and that's what we had discussed.
Yeah.
And I'm just trying to figure out as like a new grad, like and preparing myself for success. Like I wasn't sure if I should do the residency or if I should just go for straight through cash-based clinic and working for someone who owns that and not so much, obviously, I don't have the experience to own a clinic quite yet.
Yeah.
Um, but yeah, so I was trying to figure out where I could just find that mentorship, whether that is through residency or through the cash-based setting.
Yeah. So I think residency is a fantastic thing. I'm biased. I've done a residency. I love residency. I think they're amazing. Now, the reason you go through a residency, let's talk about that first. Okay. So if you're going to go through a residency, you're probably trying to get better at your craft. You're trying to get some mentorship so you can have better outcomes, right? And I think that's great. So residencies for the profession, fantastic. We're gonna show other people that we have a certain amount of training, and we're gonna do that. Great. But I think you also asked me, like, does that increase my possible wage
Yes,
increase?
that was gonna be my follow-up
Okay, right.
question.
Okay, so let's wrap this up here. So when we put this together, um, anytime you're in cash, there's two skills that you have to develop: clinical skills and sales skills. Those are the two most critical things that you need. Okay. Now, a lot of times when people go to residency, they're like, "Hey, I have all these clinical skills. I should get paid more because I've proven this and I can, help, patient outcomes and blah, blah, blah." Right. Well, when they come to the cash pay side, they're like, "Look at me. I have all these skills." But the problem is they don't know how to market or sell. So they don't have any patients on their schedule. And then they, post a couple things on Instagram with like, great form and all these other things. And, you should really, I'm a doctor of physical therapy, residency trained. And that patient is like, "I'm confused because that's what other clinics do. How are you different?" And you're like, "Yeah, but I'm residency trained." They're like, "So is your competitor. Why should I come see you?" And so that doesn't translate. And so for a lot of people, clinical skill development is your obsession, right? But that's when you're an operator. So in business, there's really four main pillars. There's marketing, there's sales, operations, and finance. And anytime that you're in a PT realm, you're in an operation based kind of setting where the physician and the insurance what did all the marketing and sales. They came to your clinic and now they're saying, "Hey, operator, I want you to stretch this person. I want you to fix them, eval, and treat them." And so you're like, "Perfect, I can do that. I went through residency training to figure out how to get them out of pain fast. I figured out how to run this ACL." You're an operator. And that's the great part. That's what you love doing, right? You're like, "I just want to treat patients." Perfect. Now, when you're cash setting, if you don't understand how they came into the clinic and you don't understand that they're still skeptical, your residency and clinical skill training is irrelevant. And it doesn't allow that patient to see how you're different. And so having those clinical skills don't equate to success in a cash-based setting. And that's so scary for a lot of people. They're like, "Well, then why did I do the residency?" That's the better question. Why are you doing this? Now, if you're doing it for internal success, beautiful, but don't think it translates to increased outcomes. As a cash pay owner for 11 years I haven't worked with insurance since my first year of clinical practice, being in a residency. And so because of that, for the last 16, I don't even know, 16, 15, 16 years, I haven't dealt with a eval and treat. I haven't dealt with insurance. So I don't know what that feels like anymore. I don't want to. But I also can tell you that there's a lot of people who probably don't want to do that either. So before people start looking at residencies, I want you to ask the question, why are you doing that? Because if you want to go in a cash-based setting, it doesn't always equal outcomes. Now, would I love a residency trained person? Sure. But I also love people straight out of PT school. I love new grads. I love people who are still hungry. Now, if that person is residency trained or not, it doesn't matter to me. I genuinely can get people to get outcomes better without the advanced training. Why? Because you haven't been tainted. You haven't been like so um I'll be nice. You haven't been tainted and thinking that your skill is everything. And I think there's a happy blend. So please don't think that clinical skill is not important. I'm just saying here in a cash-based setting, if you can't have a good relationship and be able to sell and offer things and feel good about it, you'll never survive. And despite, your 57 initials and your residency training. So now your next question was, does it increase my pay? Mm, you know what increases your pay? Increased outcomes and increased retention of clients and client satisfaction. So you kind of have to answer that on your own. Is this going to translate to all of those? I don't know for you. If you have a hard time communicating and you don't like confrontation, man, don't go into cash pay setting. If you don't like confrontation and having a hard one-on-one conversation with people, most PTs they're analytic by nature. They don't like making decisions and they need a lot of information to do it, and they avoid confrontation. That's why you chose this profession. We're very empathetic people. We just don't like confrontation, or else you would have been in law. You'd have been in another field. So if you don't like confrontation and you don't enjoy that aspect of selling and offering and building relationships and communicating effectively, and you don't love that, and you just want to be an operator, shoot, then insurance-based care is perfect for you. But that's okay. That's okay. It's just don't tell me that you don't want burnout but then you also want to be in cash pay, but you're not good at sales and confrontation and communication. So don't complain. You chose your path. You either upgrade your skills and who you are, or you stay stuck. And then don't complain to the world because you know what you need to do. You just can't get over yourself. That's hard. So as a new grad, where do you find yourself? Where do you think? Oh, I asked you this question. And how many people in PT school, we don't have to put you on the spot with your DPT class. How many people in PT school do you think that would have success in cash pay setting?
Hmm.
Like what percent of PT schools of classes that
Um,
you know of? And you probably have PT friends and other classes and their programs and everything else. Some are built to be researchers, horrible communication skills. Some just want to treat, and that's okay. And some are willing to take that risk. What do you think the percentages that would thrive in cash pay setting?
I would say maybe 10 to 15%, probably like a small percentage. A lot of
Okay.
people want to just do the work and work for somebody and not
Okay.
really like just make the money.
That's okay. That's 100% okay. So taking your data, and I wouldn't say that's far-fetched from the norm. The people listening to this podcast probably are interested they're probably one of the 10% or 15, or they're on the cusp. They're like, I'm not sure if I should or not. And the intent of these podcasts is really just to give people more information so they can make better decisions, know them the right path, and then ultimately make sure that while they're on that path, that they still have a high quality of life, they're not burnt out, because here's the challenge for a lot of people, at least, and you're going to go through this, but maybe in PT school you've gone through this. As you go through clinical practice, you question, like, do I really love this anymore? Is this the thing? Like, but that's just human nature, right? Because you're bored. You've committed to this, right? You've committed to this and you said, I do. You did your 3 years. You said, I do. You pass that test and you're in. You're in for the long haul. You have every right to change your profession. But every 3 to 5 years, your brain's gonna be like, do I really love this anymore? Should I change? Should I switch? Should I change my job? Blah, blah, blah. I get this. I understand this. And so what happens is you're committing to this and you got to be all in. So the best thing you can do is set yourself with the best environment, the best work environment to have you question that less. And so you want to make that decision. And so, if you're going to go out and branch on your own, it's a lonely world out there as a cash pay owner. If you're interested in cash pay setting, maybe not business owning, then working in a concierge cash pay setting is amazing, is absolutely amazing, but it's a hustle. It takes a lot of work on your end, on the employee end. Cash pay setting is not easy because you have to build your own caseload every day, every week, every month, every quarter, every year. And for some, that's hard. Where do you think you would struggle in a cash pay setting?
I feel like I am one of those empathetic people, but I'm really someone who is not really confrontational, honestly, but I feel like it is something that I'm aware of and I want to improve on.
Okay.
I'm kind of a person who like when I'm told, I'm like told something, I'm like, okay, I'll just accept like what the way things are.
Yeah.
And in me, I'll question like, well, what if things were like this? But I'm always I guess scared to challenge like authority and like people above me when I like in clinic in my clinical rotations I'll have CIs share with me their point of view and perspective on a case and then I'll have another perspective but when they have more experience so I'm always like oh well they have more experience so they'll probably know better than me but I
Yeah.
did forget that they're genuinely asking for my own clinical reasoning because not because it's they're trying to test me, but because they're genuinely curious about what I'm thinking. So I feel like I could be a lot better with just being upfront and having the hard conversations with like my managers or even just patients too, and they are trying to question my plan of care. They're just genuinely curious, and then I'll just have to be more clear.
Yeah. Yeah, clear communication is probably one of the hardest skills. So you were on my cash pay class on Saturday, right? And
Yes.
so if you there was two seasoned veterans, if they're listening to this podcast, so both Vlad and George, who I've worked with for a long time, and both of them had clinical cases that they needed support with, and one of them needed help with how to communicate and summarize something, right? So you do all this work, right? You tactically get that patient better. And I think where his name was Tyler. Well, let's put this patient's name as Tyler. And you struggle to the case, and this person is not getting better at the rate that you want. And now you have to have a hard conversation of, all right, so do we send you for an MRI, but that can scare the patient? Or do we keep working here, but then we risk worsening this? And Tyler has to make that decision. As a clinician, we always try and avoid that. We feel bad because we're like, fuck, I messed up. I didn't do it. And I don't want to say go get an X-ray or an MRI because they're gonna think I'm dumb, right? Like and the problem here is your lack of an ability, the challenge you have in your head to switch this around and say, you know what, Tyler, this is not my fault. Tyler, I'm going to give you two options. One option is we go really aggressive and we let's get you an MRI now. If you're concerned about your progress, let's get you an MRI now so that way as we push you a little bit more, we know what's going to go wrong. We already know have an ounce of we have all this confidence that you know that your back herniation is really bad or really good or non-existent. So then we can continue pushing you. Or we don't get you an MRI and we continue at this path, but we have a risk here. If we don't get the MRI now, you're going to question whether you needed it from the beginning or not. So, Tyler, let me put this on you. We can either go forward without MRI or without an MRI, with or without an MRI. Which one do you want to do? Instead of saying, I'm concerned that there's something worsening and we should get an MRI. You don't know how to convey that. That's not your job. Your job is to tell them which direction you think would be best for them, but you allow them to make that decision. And so effective communication is probably something you will always struggle with because some personalities are very different. And there's four main types of personalities in a cash-based setting. And you're always trying to navigate, well, how do I talk to this person? Well, it's different than somebody who's already maybe an MD, surgeon, business owner. That's a very different personality than someone who's a researcher, accountant, two different personalities, two different jobs, and they look at decision making very differently. And so it's your job. We've never had to deal with this in a insurance based setting because you're like, I don't know, just fix the knee. Fix the knee. You never had to make a decision about the sales process. So I think, at least that it's not just you, it's everyone listening to this podcast. It's everyone who will struggle with communication because you never had to do this. And in the class that I spoke with last week, I said, there's a couple different things that you have to learn in cash-based setting. You have to understand the basics of marketing. Well, there's people who spend 4 years of their life earning a degree in marketing. You spend 3 years learning clinical skill development in the operational side. And then there's people who literally thrive in sales. They get degrees in it, they get certifications, and you're saying you're going to try 3 years of clinical skill to try and figure out how to help somebody market and how to help somebody sell. It doesn't come that easily, and it takes a lot of mentorship, it takes a lot of time and effort and courses. So I think, I think cash is good for people, but I think you have to understand there's a large degree that you have to learn in order to be truly successful and not rely on clinical skills and CEUs. to be your answer to everything. And I think that's the problem. If you think residency and CEUs are going to help you make more money and thrive in cash, that's not the thing. You have to learn people. People is most important. Over here trying to treat knees and impairments and body parts. I think you're going about this the wrong way. So for some of you, you're listening to this, you're like, "Fuck, I love this. This is so cool. I never thought about this." Or your others are like, F this. I'm not doing this. I'm out of here. I don't want to do this anymore. And that's okay. Then just find your route. And for a lot of you, this is helpful to say, okay, great. I didn't even think about this. This is where you have to do. If you're attracted to this, go all in, go 100%. If you're not, get out. 1 ounce of fear or concern just sticks in you, and it's really hard to overcome. And I think that in your head, you'll live in your head for the first few years of living in cash. But that's why I think you have to find a good mentor. And so for Lise, how in schools, how do they promote finding a good mentor? What's the process? Do you have to go through residency to do that?
Well, for my school, the professors are really good about just letting us know that they're all here for us, and
Yeah.
they have like set office hours, and we can have conversations with them about cases that we're seeing in our current rotations and stuff. So I feel like they do a really good job about that. They do really push getting a residency. That's just kind of like how they prime us. It's like an unspoken thing. Like it's like, oh, all of the faculty members that come and speak with us and
Yeah.
share their lectures, they're like, oh, I had done a residency here, I did a residency here. So all of the faculty have residencies, and we have seen that they are successful and love what they do. So it's kind of like, oh, maybe I need to get a residency to be successful.
And I'm a big proponent of it. I think that's a fantastic thing.
Mhm.
Now, if depends on what you want to do. Some people, gosh, I met somebody who was like, I just want to make a lot of money right out of PT school. I was like, good for you. You have your eye on the prize. And so then I think you go home health, you can go travel, there's ways to make money fast, right? But if you want to work in a hospital, I think that's great too. Benefits are there, but the quality of life and the patient care is going to change, right? So what do you want now? What's the life you want to live? So do you want a lot of money fast? Then you're going to have to pay the consequence in the quality of care. So if you're like, hey, I got to pay off my loans, then great, then do that for a few years, pay that off, and then go on to job satisfaction. There's some people in those settings. I get that. You got to do what you got to do. Then there's some of you who are maybe hybrid or the other side. You're like, listen, I can pay off my loans. I'm going to be fine. I can play a long game, 10 years, whatever your math is. I want high quality of care with good pay. What's my options? Then I think, okay, well, great. I think that you're going to have to, if you go into in-network insurance space, I think you try and find a niche of like creating more cash pay within that, or you work in a cash pay setting where you can make more and have an opportunity to have a higher quality of life and love what you do. But you do have a little bit of stress of, okay, my schedule's not full next month. What do I need to do right now to make sure that that's there? And the trouble with where most people fall and have a challenge is they've done clinical mentors like your teachers. Well, then they're like, well, where do I find a mentor to help me like market and sell and like thrive in a cash setting? It's very different because when I remove a clinical case and it's like, well, they're leaving me every single time after the third visit. That has nothing to do with the clinical case. That has everything to do with your approach and how you walk somebody through your sequence. So very different world. So you have clinical mentors, but then you have like cash mentors. And I think that you got to separate the two. And I don't think people know that. And that's okay. This is where I thrive. This is like this gap in the world is what I want to fill. There's just not a lot of people understanding how to blend the clinical with the cash, and that's my obsession at the moment. So, yeah, out of all of that, do they introduce cash in PT schools, or do you
Very
just hear it online?
I hear it online, but I also hear a little bit about it. Right now, we're taking a business administration course, and they
Right.
kind of briefly went over the cash-based setting, but now it's more like focusing more on management and within like an insurance-based clinic. So it's not really talked about that much in my program, at least.
And that's okay. I think you're ahead of the curve. Not all schools do that. I think some exposure. I think there's going to be, like you said, 5 to 10%. So if you have a class of 50, That's five people potentially, who are interested. Yeah, I would say that's the case. So, yeah, I think, the business development, all those things are very, very important. Um, I don't I don't think that most people think about that right out of school. I had no business formal training. I don't have an MBA. I have nothing in business. I had no degree in marketing. I had no degree in sales. And you asked me, how did I learn? The school of hard knocks, but then also I think that you asked me a question. You said, how did you separate yourself? Because I gave you a stat, and I think without looking at exact numbers, but I think it's like 1% of all small businesses make it past, 5-year mark. And then 1% of those businesses make it past the 10-year mark. And those are hard. Those are hard numbers because you got to go through COVID. You got to go through just a lot of different life instances that help you push past that. And you said, what made the difference on you? I think there's two factors on that. I think that I am very tenacious. I am obsessed about thriving and winning, and I don't like being second in any capacity. And so I'm willing to do whatever it takes. And so I work a lot, and I'm okay with that. And I'm okay with that. And so I think having that, but then also understanding people is a big big thing here. If you can't if you are bad about people awareness and you're like, why is that person mad, and you can't read people, man, you are going to have a hard time in cash. And so, like, if people awareness is not your strength, will struggle. You will struggle in cash, meaning you can't read somebody's body language. You're like, when did that person walk in the room? Oh, you've been here the whole time. Like those little nuances. Oh, and that's one of my strengths. Just being able to read somebody without talking to them. And I mentioned this to you. The only reason I did that was because I was poor and dirt poor and had to eat out of trash cans. And so when I was poor, you start to learn who's trying to help you out, who's not, and who's a little bit conniving. And so those two things that I think you have to be able to push through a lot, but also be able to read people. If you can't do those, it's very tough to work as a sports physical therapist in cash pay setting. So not everybody can do that. Maybe in your PT school, you see some people, you're like, they have no awareness of people and the concepts, maybe spatial awareness. They like rub their elbows right next to you, or just like small things. You're like, you can't read that. Like, and I think people are going to struggle in that. So I think as you navigate business, all those things, I think, do you have those qualities? Are you tenacious? Do you give up easy? Are you obsessed with being the best? Can you read people? Are you okay with confrontation? Do you have good people skills? Then I think you're a good candidate. That's who cash is for, not for making money, because that gets old for real fast. So out of all those, what do you have and what don't you have? What do you want to work on, at least?
For me, I would say just I feel like I have a really good adversity,
Mhm.
and I kind of push past all of like I overcome a lot of hard struggles in my life, and I kind of push them aside and like focus on, and I have that drive on my goals.
Good,
I feel like I do have a good read on people as well. I feel like I'm emotionally intelligent. I
good,
kind of understand when like my friends or like someone I'm like talking to is like in the mood or not in the mood, like something's upsetting them or they're
good,
super happy. Like I feel like I'm pretty good about reading people. So,
good.
yay.
Good. Yeah, so the next piece here is the sales process and the confrontation, which is coachable, which is very, very teachable. There's a skill set in that. I've invested a lot of time and money into it, and I think once you find somebody to help you through that process, if somebody hasn't been through it, it's tough. There's no mentor that if they have no experience of this, I don't think a clinical mentor can really get you over the hump with the cash side because it's a different skill set. Clinically, I think they're going to be outstanding. But I think they're two different scenarios. I don't think people they'll hit a rude awakening once they come over this side. So, yeah, if you're interested in money, don't do it. It's for the wrong reason. If you're interested in a high level of care and the opportunity for more money, then those are two different things. It's a quality of life issue, right? So, based off all of those things, at least. What other questions haven't you asked me about business, about cash, about things that might help your fellow students, other people who are new grads that maybe are questioning if cash is for them? What are the questions you have?
I know you brought up a big point about kind of marketing the outcome to the patient, and I was
Yeah.
asking how you kind of navigate that to make sure that they are bought into your vision and your plan of care for them.
Yeah, so I think because on Saturday's talk that you were on, we talked about, bringing somebody, nurturing, prospective, patient or client to come in, because what happens is a patient thinks physical therapy, right? So your office is cash-based physical therapy, whatever your office is. And I think that a lot of times when they go into cash, they're like, I don't know what the difference is. Why would I? That same person just went to Joe Schmo physical therapy across the street, and then now you're saying to them you're different. And then the thing you advertise is one-on-one care, doctor of physical therapy, personalized. It's all up to you. You can contact me 24/7. I'll give you my whole life savings. I mean, you promise the world to them, right? You're like, hey, I just trust me, promise me, right? And I think a lot of times, people are obsessed about the problems that PTs have with insurance-based care. And the problem that PT has is that they are obsessed with, they want more time with the patient. They want one-on-one. They don't want to work with an aide anymore, a tech. They just want to do that. And so helping a patient understand that your problems are not theirs. So it's not one-on-one care that they want. They just want their problem solved. And so I think once you can speak to them about their frustrations and problems that you're going to solve for them, and you obsess over that seamless process, everything from maybe your website or your first email or your phone call before they come in, they got to know you're different, that you're not just physical therapy. That's why I hate the terms physical therapy. I hate it with a passion, but it's what we do for a living. But and then once they come in, it's really finding out what problems and solutions that they're looking for and what frustrations they've had, and then creating your plan of care off of that. And so I think a lot of times, sports PTs are really quick to get people out of pain fast in 3 visits. That's like what they want to do and what they claim. But you're doing damage by doing that. And I think by staying true to what the mission of the patient wants, everything from the marketing to the sales to your first evaluation and your follow-ups, keep it very, very simple and straightforward on their concerns and frustrations, and instead not on pain relief, because pain relief is going to be fast, but keeping them out of pain and getting them stronger so it doesn't happen again is a different world. And that requires minimum of 3 months. And so when you're claiming, pain-free in 3 days or three sessions, then you're just this churn, and you're not really getting people better. You're just cycling through them because they're going to have that pain come right back in a month or two. And but it's tempting. It's only because you've known that in the insurance-based world. That's what you're used to. Get people fast. You have 6 visits. I have limited resources. Got to get you there. And here you're like, I don't want to do that for you. I want to make sure that your quality of life is high, and that's going to take. That's why you have to understand strength conditioning and blocks, and being able to say, hey, these are the phases we're going to go through. And so I think when you're looking at making a big impact from a marketing and sales strategy, I think this is the you feel good about that. You feel better about this, that you're making a huge impact on their life versus their knee pain. Two different worlds to live in. So I think that's where your marketing and everything else has to change. I know it sounds really simple and straightforward, but even off of our cases on Saturday, you realized a little something different there. Let me ask you that. Let me put you on that. Out of everything we talked about on Saturday in my class, what was like 1 or 2 things that you learned?
Oh, I definitely learned to that the plan is the meat. So
Yes. Good.
that's the meat of the evaluation. That the
Yeah.
evaluation is kind of where you get the patient to be bought in.
Yeah.
And you spend a lot less time than I thought. As a student, they always teach you all these objective testing measures and then also all the special tests. And then I found myself in the clinic like, oh my gosh, I have all this time for 45 minutes to do this evaluation. Do I have time to do objective measures? But I should actually be using the extra time to share with the patient my plan of care for them and also getting them also involved in their own plan of care. And it's not just me dictating what the plan of care is going to be, but also incorporating the patient's thoughts and having them also be involved in forming their plan of care as well.
For those seasoned clinicians, you just got schooled by a student. This is amazing, right? And you're like, wait a minute, how'd she do that? And I think the concept is really straightforward. It's really unwiring what you've been trained for 3 years, plus all the CEUs that you get. Because think about this, everything that the APTA pushes, everything that your PT school pushes, and everything CEU course pushes is insurance-based model. Think about that. Everything is dictated by insurance, right? So why don't PT schools push more cash? because that's not on the exam. So they have to teach you what's on the exam. What's on the exam to be a good clinician, not how to serve people for better health long term. It's, can I get you what I call baseline? Can I get you out of pain and get you going up and down stairs in a safe manner without you having a heart attack, having stroke symptoms, whatever it is? That's your job. So of course you're not taught any of these things. And the APTA is same thing. They're fighting with insurances. They want to say that, hey, we're going to do a great job. Yes, you're fighting for direct access, but that's not the main hub. The main hub is, how do I get insurances and other physicians to stay on track with what we do? So everything you're teaching and been brainwashed for is how to be a good insurance-based clinician. And so here, all we're saying is, no, 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 we're going to learn how to treat people. You got to communicate effectively, build long-term relationships, everything the reason you signed up to be a PT. But no one has the opportunity. You haven't had the opportunity to learn how to manage somebody's health so that they don't have symptoms and you don't just get them out of pain fast. And so, that concept takes a little bit of time. And so Elise learned a touch of it on Saturday. And if you guys love these classes, I'm hosting them monthly, just so I can get people thinking in the right direction, right? That's ultimately the goal is, it's not about cash, it's about people. And I think you can apply a lot of this to insurance-based care, but the reason I do it is so that you can start having some strategies in insurance-based care. How do you create a niche for yourself? You're like, I love my job. I've been here for 7 years. I don't want to leave it. Great. Create something different. You can create a niche for yourself. So, yeah, no, hey, at least good job. Good job. That was pretty good. That was off the cuff. That was great. That was great. So what other questions do you think students would have about cash and anything else that would be a great, good resource for them? What other questions would you want to ask?
I feel like people might be curious about how referrals might work with insurance space. I feel like hospital connections already there, and the patients just, you don't have to worry about not having a full load. Whereas cash based and owning your own clinic, you're like, oh, I'm kind of starting from fresh. Like, where do I get connections with surgeons and doctors for referrals? And so, how would you navigate that?
Yeah, yeah. So referrals come from multiple things. There's online, there's offline, there's community events. And when you start to work in a cash-based setting, you're different, right? So referrals from physicians are much less. I think to date, in 11 years of business, I'm trying to give you the exact number. I don't think I've ever had a single referral from a physician, like prescription. I don't know what that looks like.
Mm.
Right. So, I think the your initial phase, I think you have to really push yourself out there. And even if you work in a cash-based setting for someone else, it's the same scenario. You have to be doing community events because you got to prove that, that Elise is different than everyone else. And the only way they're going to meet that is confrontation, good conversations in front of people, eye contact. Listen, I know you've had struggles with other bad physical therapists. Here's what I'm going to do for you, right? Let me get you in for your first session. Let me show you what this is going to look like, right? You have to be out there because the concept of physical therapy, your name, your physical therapist online looks the same as everybody else. And so I think you really have to break that mold, and your first 2 to 3 years are rough in a cash-based setting. Even if you're employed or owning, it doesn't matter because you got to be out there and grinding, and making and going out there and meet people face to face. If you want to do online and all those things, but Instagram and all those things, those are long games. I think you said this, like everybody moved online, and then now it's like it's almost saturated, and people are like they don't believe what they see anymore, especially AI and everything else. So for people to have like a conversation in front, it's like whoa, whoa, that's weird, And I think we've shifted towards that model, and that's always been my game. I just love being in front of people. I love showcasing how I can help and those type of things. And just people listening to this might be like, oh, I'm interested. It's only because I'm in front of you, right? Like I'm literally in front of you. And I think in a cash-based setting, I think you have to do that. And whether you work for me or anybody else, that's the norm. You got to get out there, and you got to get your face out there. And if you expect that your residency trained, you've taken 27 CEUs, and you have 27 good, really, really good letters of recommendation, doesn't mean your schedule is full. That's the problem. So I think your early years are the grind years. You're out and about. You're out and about as your main premise. And again, if you don't like confrontation, you don't like face-to-face communication, you don't like reading people, that's why I'm saying that. Not because I think you're different or anything. I genuinely, I'm telling you, you're gonna have that problem. You're gonna face it because you won't have anybody on your schedule.
Right.
Oh,
I
so
have I have one more question for you.
tell me.
I'm trying to think. I was like so locked into what you were saying. I was like, oh my
No
gosh,
worries.
what's my question?
No worries.
Um, hmm.
All right. So I would say that's your primary. Yes, you can get online, but I think you be yourself. A story that I tell is one of our physical therapists spent like 2, 3 hours on these like video series, right? Like, putting captions and doing all these really cool things and effects and exercise and all these other things. And they spent 2, 3 hours on that and they posted online. And I just shook my head. I said, oh, that's fine. Let's do it. And it got like 100 views, right? And it was hours of work for like 100 views and like 2 likes. And the reality is like people see that and they're not attracted to exercise. They're not attracted to the cool video. You are. So you're trying to sell yourself, but you're not the customer.
I
You're
think
a
that's my question.
okay, go
Just
for it.
sorry to cut you off.
Go.
What are the community events that you have attended? I know it might be a little biased since you're out in San Diego, but how were you able, in your experience, to put yourself out there and be able
Yeah.
to have those confrontation moments?
Yeah. I think you like if you like athletics and you like sports, I think you got to be at high school events. I think you have to be at wellness fairs. I think you have to be at anything where there's exposure of like high school athletics, there's collegiate athletics, wherever your athletes are, go there, or maybe where their parents are. I think you have to figure that out. And so, I wouldn't waste time and money on things that maybe if you went to like a job fair, and it was a job fair for I don't know, college students. I'm not sure I would do that because maybe college students aren't the best patient because they don't have money. They don't have expendable income. And I think the hard conversation for a lot of people, it's like you got to figure out, are you a for profit or are you a non-for-profit mindset? And so when you work for a hospital, it's like, oh, everyone's good. Let's just help everyone. You don't have to bill that. That's okay. And then this is a frustration when you go for work for an insurance-based clinic or whatever, out of network, whatever it is. You're like, oh, like they want me to like offer these things. Well, the difference between you feeling good about it or not is the other side. Do you really feel that this is a benefit to the patient? Do you feel it if it is or not? And so when you're given units to provide, you don't like it, but when you're in a cash-based setting, getting them to a 4 month or 5 month plan of care is helpful, because you're now keeping them injury-free. But now it's just the way you see that.
Mm.
It's not that keeping them for longer is bad. It's just that's an insurance-based model. So I think you go to places where your athletes are. Go where your athletes are and go where you like where's your customers. I think you hit that model, and then I put it right back on you. Find that, and I've done so probably hundreds, and I don't know about thousands of workshops, or community events to do that, and they're hit and miss. And I think that you learn from what worked and what didn't, and it's a big cycle. There's a couple courses that I offer that it gives you more of the intrinsics and the layering of like how to do it. But I would say generally just find where the athletes that you like to work with, find where they are, go there, and then just spend your time there. So if you
Sounds
love
good.
soccer players, obsess about them, find them where they at, go at them, attack them. Yeah, that's where I usually put anybody who comes to work for sports performance and me. That's where your first 6 months, you're exploring who do you like working with, and then we're putting you out there.
Great.
hmm
I
hmm
love it. Thank
Good.
you.
Okay, so I want to make sure this is all relevant and helpful for people. But what last questions do you have for me, Elise, about cash, sports, working with athletes, what to look out for, what to consider, or are you prepped and ready?
Maybe one more thing, for owning your own
Yeah.
cash-based clinic. And I think we talked about implementing a culture that is like probably one of the most important points in owning your own clinic. So what qualities do you look for in your team members that you hire in order to make sure that they are fitting that culture? And what is that culture to you? What does that look like?
Yeah. So we have 10 core values that we live with. They're the house rules. It's what everybody abides by. It's like it is everything. You walk into my house, you're following these rules, right? Say, for instance, I'll go to your house. I'm gonna take off my shoes. Whatever your house rules are, I'm gonna follow what they say, right? At least this is your house, right? You come into my house, these are house rules, right? So I have 10 core values that everyone adheres by. But it's really simple. The qualities that I look for are the things that I told you earlier, ready? I want somebody who is emotionally intelligent, can read people, right? I want somebody who is resilient. And I can tell you, I think the reason why people don't do well in cash, they don't like rejection. They don't like not being number one, and they can't handle it. Cash is hard. It is very hard. And if you're sensitive and you can't take constructive feedback daily or weekly and it hurts your feelings, go to insurance where it's a little bit more fluffy and you feel good about yourself, even though you're not making progress because no one's telling you that. And so if you don't like progress and making improvements in your life, think about this. Since college, your parents have very little impact on how much you're growing since the start of college because they got you to 18 years old and they're like, see you later. I've molded this person to get there. Now you're like, I can do this on my own. Okay. And then you have college professors who did that for you. Really good people. Maybe you still connected with your family and friends, but if you're now in physical therapy and your parent is an attorney, they can't help you anymore. They can help you with general layout, but then you're like, great, now who do I ask? And you found some professors, ready? And then when you finish school, who's doing that for you professionally? Who's doing that for you? Who's looking out for you? Who's still pushing you like your parents did? Who still does that for you? No one. And so that's why when you go out in the real world for 3 to 5 years, you get burnt out. Why? No one's helped you understand the perspective of what you're about to do and what you do for people and how hard this is and pushes you every single day. Why are you being lazy? Why are you late? You're getting soft on me. Those are hard conversations to have. But as an employer, that's my job. My job is to push people more. And so if you can't do that and you're not okay with that, don't come in. But it's better that you know that now. So don't come in with credentials, residency, and clinical. Show me resilience. Show me you're going to be okay with challenge and confrontation. Show me that you're okay navigating people and having awareness. And show me that you're going to push yourself every single day. And you made a promise to yourself that you're going to hold. Because I get it, I get that opportunity in 9 months to remind you. I know this is hard. You said you're going to grow, but you haven't listened to a single podcast, no books, and you're living nice little fluffy life. You chose this path. Now, do I go easy on some people on quarters of life? Yeah, I get that. But my job as a whole, from January 1st to December 31st, is to make sure that you are thriving and you're professionally growing. That's my job. That's it. Because it's my house. My house rules are pursue professional and personal growth. That's one of my core values. You're not doing that, get out. So my company, the way I work, is about not letting people drop 1 ounce. So I hope you felt that when you were a client, when you were an intern. My job is to push people. And so I think that's a culture that I have, but not every clinic has that culture, and that's okay. What's the working environment that you want? That's what
For
it comes
me
down to.
personally, I definitely think that it's important to continue to grow. I think as a profession, physical therapy, I feel like people can't really plateau and there's always new research out there and there's always
Sure.
opportunity to grow. And I agree, it's very important to not get lazy or you just have to keep up with the research and your education and continue
Yeah,
to
but
yourself as well.
the challenge for a lot of people in their early years of career path, or maybe PT school, is that they haven't got hit by life yet, right? So now You come out of school, you're paying loans, and then you find you get your first apartment, you buy your first couch, your first TV, your first dog, and your dog gets sick. And now you're like, shit, I know $2,000 to this. God, my pipes in my apartment burst, and now everything is wet. Great. My car broke down. I don't have that. I don't have it right now. I don't have transportation. I got to Uber everywhere. Great. Got it. Well, my partner broke up with me. Those are all the things that take you off of life. And then your job then becomes last resort. No, 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 no. You still got to maintain that.
Right.
Life happens to you. That's why it's so easy and it appears really easy right now. I'm going to grow and I'm going to be the best PT. Yeah, because you don't have a lot of life happening to you right now. Once life hits you in the next 5 to 10 years, it's very easy to see how your professional career takes a second seat. And that's just what's going to happen. And I think it's important for you guys to know that. So as an employer, these are the things that we look for. I connect with thousands of employers on a regular basis in a cash-based setting, insurance-based setting, and I get that. And the great beauty of this is I'm more transparent with people applying to me than others that are not. And so it's interesting to see they have these expectations, but they don't want to have the hard conversations with you guys. I'm willing to do that because I know who you are and what you want. And if you want that and you want to make more money, more opportunity, you gotta stay high professionally. And if you're not ready to do that, then it's going to be tough for you to be in this setting. And I'm just giving you a reminder now. So in 3 years, I can say, you remember that time that we agreed to this? And my job is to do that for you in 5, 10, 15 years. I have people with me for 8 years now. I have people with me for 6, 7, 5 years. And it's tough, but that's probably the thing that they love about me, also the thing that they hate. It's just what it is. Just what it is. So, all right. Last question, Lise. What else you got for me?
Um, how do you determine the cost for your cash-based setting? Because I know with cash-based I think we talked about this, how some people want to almost pay a little or charge a little bit less because they're like, oh, I feel bad and I want to help them and I want to be
Uh,
affordable. But I feel
yeah.
like that also you were saying that kind of makes you a little bit different from other cash-based settings and why out of all the small businesses that how a lot of them do fail. Like that might be something that helped you become successful and to remain successful throughout the years.
Yeah, pricing is tough. I think my first person I ever charged was like $100, right? And I was like, well, first it was free. Let's get real here. It was like, oh, I'll treat anybody like free. And I think you start to gather more confidence, but I think you price according to what you feel is going to be important for you to be able to survive and thrive. As you get further and further into business, your pricing has to go up because you want to employ really good people. So if I have good clinicians, I want to keep them. I have to adjust pricing because I got to be able to pay them those wages. Or if you're like, hey, I'm going to be employed by a cash-based scenario, or in a cash-based setting, you've got to find a place that doesn't have a cheap cost per session because then that caps on what you can make. People don't know that. So you got to be in a setting where you have enough people willing to pay that price. If you're a rural America, you might find some challenges getting people to pay $200 a session. $300 session, whatever that is. If you're in a metropolitan area, I think that you'll see prices anywhere from I've seen from 200 to 500 an hour. I think that's a big range. It depends how big the business is. But I think that you start with maybe fair market within your area. For some people, that might be 250. Some people might say like 125. The only reason you're saying that is because you have a hard time associating with your value of what you're going to be able to produce for them. And I think that you got to get over that, find out the thing that you can produce for them, focus on the outcome and deliver on that. So I think that pricing, if you're going to start off right off the bat, whatever you're thinking, add $50 to it. Whatever you're thinking, just add $50. If you're like, oh, 125, go 175. Great. You're thinking 175, go $50 more than that. Just because, again, the operational side, the clinical skill side, you don't know the marketing and the sales. So you're just rating your rate on this. And there's so much for you to learn. I think you start there, overcome your fears, and then you start to build off of that. I think that's why you need somebody in your ear all the time. You just can't see it. And I think as a new grad or somebody trying to just start a cash-based company, there's a lot of layers to this. There's a lot of layers, as you can tell. To you, what's the hardest thing right now that you are like in your brain? You're like, what, this sounds really tough. What about cash sounds tough?
I think just getting in people's faces about, well, for owning my own clinic, for like being the business owner aspect of it and getting the referrals, well, it's your responsibility to market your skills and market your business. But for working for a cash-based clinic, I feel like also too just being not being afraid of criticism. I am someone who's not really, I'm used to it, constructive criticism, because growing up I've been playing soccer. My coaches have told me like, oh, I need to work on this, I need to work on that. Sometimes they're frustrated and then it's not even in the best. They're
Yeah,
like yelling at me and I'm like, okay, I'm sorry.
yeah,
But I
yeah.
do know that they mean well. So I feel like something that might be a little nerve-wracking for me is I feel like I need to make my clinical skills a little bit better before
Mhm.
entering the cash-based setting. And that's why I think what drives me towards your clinic, honestly, if I were to work for a cash-based, your clinic is like gold star standard, because I do know that you offer some mentorship and clinical skills, and you guys always are repolishing that. So could you tell me a little bit about how that looks for your clinic?
Yeah, so we obsess about this. So I was raised in the professional athlete world. So in a professional athlete world, you might have like nine clinicians who work on a client case or an athlete case. So you have an athletic trainer, a physical therapist, massage therapist, chiropractor, acupuncturist, primary care, surgeon. Everybody's working on cases on that one case. So I worked in pro sports for about 10 years. And I love that about it, right? That was the thing that really heightened me. So when I started going concierge on my own, I was it was hard for me to explain what my services were because I had learned 10 years underneath chiropractors, massage therapists, athletic trainers, surgeons. So I knew primary care from my sports primary care physicians. I knew meds. I knew dermatology. I could adjust like a phenomenal chiropractor. I could massage. I could do on-field training. I could do spine boarding. I knew that. And so when I did that, I was like, what am I going to say? Like, I'm a physical therapist, but the public like won't understand what I can do for them. That's why I just need to get in front of their faces. So I think that when you are looking at this in mentorship, I made a decision in my clinic to close down the clinic for 2 to 3 hours every single Tuesday. And we do mentorship every Tuesday. And we go over marketing, we go sales, we go over cases, we go over programming, strength and conditioning, we go over all the things that are essential in a cash-based setting. But that's very difficult, but that's carved out. It's 52 weeks of that. And from a business perspective, doesn't make sense because it's so much money lost in revenue. And so I commit to that. I commit to 2 hours. And but that's the for me, it's the thriving in consistent education and progression and pursuing professional growth that I want the entire team to do. So I lead by example. Some clinics won't do that. It'll be like, off the cuff and you go find yourself and you maybe find in a half hour there. It never comes out structured. And so we create blocks of quarter goals that we want to do. So this quarter is going to be everything from strength and conditioning, and this one's going to be acute care management. This one's going to be this, and so we go through these educations while navigating, cases and things like that. But I'm an educator, so I actually do CEU courses and non-CEU courses on a quarterly basis, all online or in person, and then also I do that for my staff as well. So they're constantly evolving in that, and I think it's very difficult to be complacent. And if you're complacent, you find yourself out. A lot of people say that they want to work and grow. And when they come into an environment where it's like 52 weeks of it plus CUs and weekends and all these other things, they're like, holy shit, maybe that's not for me. And so I think once you get done with the triple A's and the double A's, I think when you come to the pros, it's big. It's a lot. It's a big commitment. So we model after a professional setting, pro athletes, and that's the way I run my business. But it doesn't mean that you have to in anything you do. I'm just telling you that there's a lot of students out here, a lot of new grads, and they're trying to figure out their case and what they want to do. My way is not the only way for everyone. I think you find what works for you in your setting. I think it's very critical for people to understand. Mine is definitely not the end all be all. It's for specific PT. It's for a specific PT who wants that, and that's all I need. That's all because these are my house rules. That's what I love. Now, if you're designing your own and doing those things, you go off of your house rules. If you're going to be employed by a cash setting, learn their house rules and see if you align with them. That's the best thing I can tell you from an employee standpoint. Start looking at their house rules. Let me see your core values. Show me what a schedule looks like every single week, every single month. And then that gives you a better idea. Like, oh, you're either a lot of talk or holy shit, you guys, your stuff together. I like this. That's a better concept of I'm gonna mentor you for clinical skills. Don't do that. Don't do that.
That's true. I feel like you can get some mentorship, but if the culture and the house rules aren't aligning with your values, I feel like it's just like
Do you
I
get
feel
that?
like I can, yeah, it's just not as fulfilling.
Yeah.
And
So now I'm giving you guys how to interview properly. So yeah, so now these are critical skills. So but it's good that you guys have them, right? So I'm very transparent in how I run my stuff and when anybody comes in to apply, that's what I do. I explain the house rules because I want you to align to what I'm gonna do. And the mission's pure. We're always about helping people live their best life. And I think if you know house rules and you know their mission, you're very clear on that and you see it happen on a week-to-week basis, man, you're in a good slot. Or you go to insurance-based care, they're like, we don't have any core values, we don't live by them, we don't have any meetings, we don't do those things, and it's off-the-cuff mentorship. They just answered the questions for you. So that is a interview strategy that you should guys should be doing.
great. Okay, one more question.
I mean,
This might be a little bit off topic, but kind of in the same realm. Do you feel like a PT, a new grad PT, do you feel like their level of confidence will kind of help determine if they should go the cash-based route or versus insurance-based route?
yeah. So truthfully, I can read very quickly if a new grad's going to survive or thrive. Now, for a lot of you, you don't have the confidence, and that's okay. That's okay. When I see a new grad who has a little bit of confidence, but I can break through, and I know that you're going to be ready. Just give me 6 months. But I'm not pulling you 100%. I'm saying I'm going to add 50%. You throw your 50%, and we're going to be awesome together. I can read that very quickly on a first interview by the level of confidence they have or insecurities that they have. And it's better to be honest and transparent because the more insecurities you have and you have this, I forget what they call it, where you fake, how much confidence you have.
Make it till you make it.
Yeah, fake it till you make it, right? And you have that, right? I can read that and it puts a yellow flag for me. So the best thing you can say is, I'm not 100% confident about these four things. I don't love confrontation, but I'm willing to put myself out there. That tells me, holy shit, you know your weaknesses and you're willing to work on them because you verbalize that to me. You're honest with me versus I'm not gonna have a problem. I can crush this. I got it. Boom, boom, boom. And you're inside your head, you're like, fuck, I have no idea what I'm about to do right now. So I don't think you do that. But I think that confidence can be built massively with the right mentor in front of you, somebody who can read that and be like, I got you. Like, I'm going to raise you with me right there beside me. I got you, but I need you to do all the work. But I'm going to instill, here's the criteria I want you to meet. Here, I'm going to meet with you weekly or monthly, whatever it is. And I hope you get there. That's different. That's somebody who's trying to raise you up. They're going to be the rungs in the ladder so you can just climb. But I think that's why you try and look for a mentor and you got to be honest with them. And if you're not, that's a bad relationship. You got to be honest with your mentor. I'm not confident about this, but I want to be good. I want to so be good at this. How do I do that? What am I missing? And that level of insecurity you're not used to because you've gotten this far with it and you've never been able to break through it. And that's why you still have it. No one's been able to break that because you didn't trust anybody with it. The minute you have that and you break free from it, and that mentor is like, I'm okay with that because I've had that. And somebody helped me with that, or they did it themselves, whatever it is. But I think it's nice. It's refreshing because you're human. And as an employer, that's nice. It's nice. I'd rather have a team of people who are genuine and honest than people who are faking it till they make it. And I have a culture of people who are insecure in their lives in their head, who are just pretending to be good at their job. That's a really bad environment. That's a really bad environment. So, in the people that I mentor, both on my CEU side and the Chris Garcia Academy side in my business, I've seen people break out of it right around their 9 month mark or their 1 year mark under a lot of mentorship for me. And it's because you have this thing in your head that's trying to protect you and you don't want to look bad. And you're like, no, no, I'm good. I'm good. I'm good. I'm good. I'm good. I'm good. And then your patient list is not showing up. People are dropping off. You're not successful clinical client management. And at some point you're like, fuck, I am not good at this. Why am I not good at this? And then you're like, why did it take you so long? I knew what the problems were. I was telling you where they were, but you just weren't coming to terms with me. And you realize, shit, I should have been honest from the beginning. Yeah, but you're human, so you try to protect yourself. So confidence is can easily be brought up. Self-belief cannot. There's a big difference there. Confidence is external. Self-belief is internal. You got to be open and honest until you can really have that self-belief that like, I know I'm telling my boss or somebody that I can do this, but I don't believe it inside. That inside is self-belief. That's what you have to raise with the right person. Confidence is false and fake. And I think that you have to find somebody to bring out that self-belief in you. But you got to have that first. So if you're applying and you want to do a cash based, you have some self-belief in yourself. That's great. But then you don't have the confidence to get there. It's because your self-belief is not there. That's why you need somebody to raise that up. Confidence is just comes with it. Confidence, self-belief, two different worlds.
I didn't think about it that way, but that's different perspective for sure.
100%, because confidence, it looks like you have it all, right?
Mhm.
You've got you're wearing the stuff, you got working around the clinic, you're like, I'm just crushing everything. And at home, you're like, fuck, why am I not good at this? So if you can be confident at home, that's self-belief. That's like you got this thing down. And you hit this trajectory once you hit that. I remember I hit that probably 5 years into clinical practice for me personally. And it was tough working in pro sports, but I was on an island. I'm stubborn. I try to do it by myself for a long piece of this. And I would seriously find somebody. It's not until I found like two or three people. And actually, my father-in-law is one of those people who helped me with my self-belief. I don't know if he actually knows that. So I hope he listens to this podcast one day. My father-in-law has some massive self-belief. And, I was pecking his brain. What do I do? Business? How do I do this? And he really just gave me honesty. And I was like, I don't know what to do. What do I do here? And he's like, oh, just go this way. And I felt dumb at the time. And he made me feel so good. He's like, oh, it's normal. I was like, oh, fuck, I should have asked it. So I just started exploring and my self-belief in business just skyrocketed. And now I feel amazing about what I do. I have zero insecurities. I'm very open and honest and transparent. And that is self-belief coming out. That's not confidence. That is true self-belief. And for a lot of you, you want that feeling. You just don't know how to get there. You know what I mean? As a student, fuck, every student has it. Every student has it. Like, I don't know if I'm gonna mess somebody up, mess up this post-surgical. So yeah, does that answer your question?
Yes, thank you.
Awesome, awesome. Well, good. Hey, so everyone, I appreciate your time. This is quite the long podcast, but ultimately, I think a lot of people are going to benefit from this because this is who you are. You're thinking all these same things. You're a new grad. You're a seasoned veteran. You're a DPT student, and if you're thinking about cash and you're thinking about going to this, I either attracted you more to it, or you're like, this thing is not for me. In either case, that's helpful before you start spending more hours of mindless time online being fed by people to push you in this direction or go a different direction. It's, really what does it come down to? What options do you want in your career path in your life? What money do you want to make? What balance do you want to have? What impact on the planet do you want to have? Who you're going to do it with? These are all critical steps. Instead of saying, should I do a residency? Better question is, what do you want out of life? Who do you want to be surrounded by? What are the core values you're going to live by? And then if residency happens to be in that path, then it's a no-brainer. But if you haven't thought about the other side, start there first and then figure out if a residency is best for you. And that's what your mentors and your teachers and everybody else should be doing for you. So I hope they're doing that. And maybe just pushing you in the right direction to give you the self-belief that this is the right direction for yourself. So Elise, thank you for your time. You are a absolute rock star. And thank you for your time. You asked me a couple questions on Friday, and I thought it'd be great for the planet to hear it because there's a lot of people who have the same exact questions who maybe haven't had the confidence to email me or ask other people, and they've been living in their brain. Now you can actually get those words out and you feel comfortable about your next path. And now it's navigating, all right, now just push in that direction. And if your path changes, that's okay too. It's just at least you have an understanding that now you have a little bit more of an arsenal to help you decide if things are right for you at that time. So, out of all the things that made this time for you, at least worth it, what's one or two things that you really hadn't heard, or now you're walking away thinking, I feel like I'm on the right path? What do you got?
I'm definitely gonna carry with me thinking about values and like what to make sure where I'm working has the same values as me.
Hmm.
Because if they don't really have the same values as me, I feel like it might cause me to not really feel fulfilled, and then the burnout will come sooner than, and it really shouldn't at all because it's just all of an emotional connection.
That's it. That's powerful because burnout is just a concept, right? But if you love what you do, core values are there, burnout doesn't happen. Yeah, you just made the wrong choice. All right. Well, thank you for your time, Elise. Thank you, everyone, all listeners. For those of you who are joining onto my classes, I think they're on my website. Go onto my email list. But I host monthly classes for sports physical therapists interested in concierge care, working with higher level athletes, pushing them into strength conditioning, having a greater impact than just getting them fast or getting them out of pain. How do you make a really big impact on the athletes and active people that you care for? Take my monthly class. If you love cash pay and you're all in, you're like, Chris, I want the next step, take my elevation course. If you're just interested in what to do in sports, then take my Kickstarter course. In other cases, there's resources for you that are not just the boring, typical CEUs, residency, blah, 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 APTA, blah, 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 research. Those are all good things, but when placed in the best environment and you love what you're doing, it's going to be the best case scenario for you. Okay. I will see you guys on the next episode. Take care.
Hi, if you found this video helpful, please give it a thumbs up. Don't forget to subscribe and hit the bell notification for my weekly tips on treating cash pay patients, becoming that expert in your community, and thriving in business. Thanks, and I'll see you soon.